The entire purpose of advancement in technologic and science and research is to extend life and is to make life better and is to have your loved ones with you longer who are living with cancer or diabetes or any number of conditions that we can all get. So I can't say that I understand the attacks on health and the attacks on science, because those seem to me as bipartisan as it got. Well, thank you so much for having me. I'm going to go through some events that have happened over the last 8 months. It's been pretty dramatic, actually. So we will, in this talk about the impacts of the new administration on global health. We'll review what's happening with the Department of Health and Human Services, which is our global way to manage health in this country, and then just what's happening on the ground and how are we all being affected. So let's start with global health. And the first thing that happened in the current administration was actually on Inauguration Day. And there was an executive order that day that the U.S. was going to pull out, and has pulled out, of the World Health Organization. So we were the largest financial contributor to the WHO. This was following a pandemic where the, sort of international cooperation was really essential. This has led to the WHO cutting jobs and slashing its budget. So this is, in actuality, doesn't look like, unfortunately, this is something that we can change right now. This also led to, for example, the WHO, on the context of this, putting out guidance about what do we do in the face of U.S. funding cuts in light of the cessation of antiretroviral therapy, which is the way how we manage HIV. So they've started to put out recommendations in the context of the U.S. funding cuts about how do we deal with the fact that so much foreign assistance, so much foreign aid is being canceled that people are actually not being able to access their medications. I do think that the stopping of HIV medications is going to be something that's very profound for the world. For example, in 1991 was the collapse of the former Soviet Union. And what that led to was stockouts of tuberculosis medications. People then would have their TB medications at home. They would take them every 3-4 days, try to make them last as long as possible. And that's what led to the rise of multi-drug resistant TB. So I do think that these kind of off and on antiretroviral therapy or HIV therapy is going to lead to HIV drug resistance worldwide. The second thing that happened was PEPFAR. Now, the PEPFAR program, or the President's Emergency Plan for AIDS Relief, was actually started by President G.W. Bush in 2003. And it is a program that supplies and helps other countries, low-income countries specifically, get access to crucial HIV therapies. And it is by far the most successful global health program ever created. It saved 26 million lives and prevented many children from being born with HIV. So what happened that first week of the administration was January 20th, we pulled out of the WHO. January 24th, which is Friday, there was a sudden announcement that all PEPFAR activities have to stop. Now, there were people in the State Department, because the PEPFAR is under the State Department, that ran around trying to get models of how many people would die as a consequence of stopping PEPFAR, and they got that on Senator Rubio's desk by that weekend. And on the 28th, which was a Tuesday, there was allowance of some resumption of PEPFAR activities for treatment, but not, unfortunately, for prevention, except for in pregnant women. And the problem, even with the treatment aspect and saying that treatment could be continued, was PEPFAR's collaborating partner was USAID. And what was happening with USAID is that it was simultaneously being completely gutted. So I think that it's poignant to say that there's something called the PEPFAR impact counter, and it's keeping track. It's a model developed by investigators at Boston University. It's keeping track of the number of excess deaths that have occurred since January 24th, since PEPFAR was hobbled. And at least at this point, it looks like 74,000 adults and almost 8,000 children have died of HIV as a result of the hobbling of PEPFAR. It is not true, though Elon Musk, who was put in charge of DOGE and the Department of Government Efficiency, he said that no one has died as a result of these foreign assistant cuts. But that's simply not true. I was actually in Kenya in February, just a month after PEPFAR had been really hurt, and there were people lining up around the block and not able to get HIV medications. This is an analysis from the Clinton Health Access Foundation about what is actually being affected by these PEPFAR cuts. And it looks like treatment is really severely disrupted. Prevention is severely disrupted, but testing is, and monitoring is as well. And one thing I want to say is that the reason people are dying is the other thing that PEPFAR also provided was treatment for some of these severe infections. For those of you who lived in the city for a long time, we were the epicenter of the HIV epidemic in the 80s and the 90s. It was the reason that I came to train here, because I wanted to be an HIV doctor. And people were dying not essentially of what are called opportunistic infections. People are dying because the HIV virus affects and kills the immune system, and that leads to individuals being susceptible to severe fungal or viral or parasitic infections. And so the reason that 74,000 adults and almost 8,000 children have died since this PEPFAR, since PEPFAR got halted or hurt is because it's end-stage AIDS, that people were already very sick and then aren't able to access even the life-saving treatments for opportunistic infections. So it's advanced HIV disease, and how many people are on the precipice of 40 million people living with HIV worldwide of advanced HIV disease, why there's been deaths. So giving any sort of talk like this means that you have to update it within hours of the talk. And I had to send an update because actually just today, what had happened is that there was what is called rescission package that had been put in, that the White House had said, look, we're going to cut all these programs that we had, hurt, and then essentially money hasn't been spent, and we're going to slash them and cut their budget permanently. And luckily, actually, there were several Republican senators in the Senate, Susan Collins from Maine, Lisa Murkowski from Alaska, who kept on being told, well, this is the most life-saving global program, and HIV in low-income countries will lap onto our shores. And they pulled out just hours ago out of the rescission package the PEPFAR program. So the White House allowed that. Russ Vought, who's the kind of mastermind of a lot of these cuts, allowed PEPFAR to be pulled out, which means it's a very good thing because it's not going to be at least permanently cut by a rescission package. It doesn't mean that we're going to get restoration of full funding in the future, but at least right now there's a kind of pause and some relief about PEPFAR. The reason PEPFAR was so hurt, actually, is because USAID got gutted. So the way to think of USAID is this was the concept of soft power, the concept of that JFK had, that if we gave foreign aid, if we gave foreign assistance, we would be liked, we would have global diplomacy enhanced, and frankly, Africa is going to send its minerals to the U.S. or China, and they're certainly not going to send it to the U.S. if we're not doing anything in return. And the USAID, unfortunately, very quickly into this administration, got profoundly profoundly gutted. And actually what I mean by that is that first 83% of contracts were just all over the world, foreign assistance, child hunger programs got slashed. And then there's a law, U.S. law, that you actually have to keep 15 employees of USAID, so they fired everyone except for 15 employees. And so 10,000 people have been laid off of USAID, and at this point there are 15 lonely people sitting in the State Department doing very little with very little that they've been given. So that actually happened on March 28th. So USAID is sort of the way that the administration controlled that is they moved that under the State Department. It's actually no longer control of Congress, and no matter how much Congress tries, I think USAID actually will not come back in this administration. So what about here in the United States? So that makes us think, okay, how do we organize health and health programs here in the U.S.? And the way that we organize health is what's called the Department. Yes, well, you're responding to our Secretary of HHS, who's RFK Jr. But it is true that the way we think of the Department of Health and Human Services, there's these 8 agencies. And I think only healthit.gov, which I think does some computer stuff, has not been severely hurt under this administration. So CMS is Medicare and Medi-Cal. And then HRSA actually does a lot of sort of treatment programs, including AIDS. And we all know, of course, CDC, NIH, and FDA. So I'm going to talk about those in a little bit more detail. The Department of Health and Human Services was actually started in 1953, and it was put together with education. So that was the biggest department in the U.S. government. And then in 1980, education became an independent entity, and the Department of Health and Human Services was essentially given a budget of about $1.7 trillion. Now, that seems like a lot, except for the fact that it manages so much of what so much matters to us, which is public health. And it matters, the HHS manages healthcare coverage and affordability, so Medicare, Medicaid. It manages public health and disease control, CDC. It manages emergency preparedness and response, Food and Drug Safety, FDA, Scientific Research and Innovation, which is the National Science Foundation, National Institutes of Health, NASA even, and then supports families and communities. So if you think about what's under HHS, it's a lot of what matters to us here in this country, and likely what a lot of people want their taxpayer dollars to go towards. But this was HHS prior to this administration, and what happened in this administration is that essentially RFK Jr. did get confirmed as the Secretary of the Department of Health and Human Services, which is unusual. He doesn't have actually training in health, not a doctor, not a PhD, not someone who has had particular expertise in anything, had actually an organization that he founded called the Children's Defense Fund, which was, if you really look that up, it is truly an anti-vaccine site. He had to separate from that prior to being confirmed. And after he was announced on February 13th as the candidate, this announcement came out from the White House, which we're going to reorganize everything under something called MAHA, like MAGA, but Make America Healthy Again. And their vision for MAHA is that they took HHS and they took 82,000 employees and they cut 20,000 of them. So when you think about all the federal layoffs that have occurred, a lot of it has occurred within the HHS. 28 divisions were consolidated to 15. And all of these things happened. 3,500 employees fired from the FDA, 2,400 from the CDC, 1,200 from the NIH, CMS, which is Medicare and Medi-Cal, 300. And all of these changes started occurring. Every organization was suddenly understaffed. Things couldn't happen at these organizations. And there was a hope, actually for a while, that on May 9th, a federal judge said, you can't do this. You can't actually fire federal workers from all of these agencies because by definitions that's restructuring federal agencies. And the executive branch shouldn't be allowed, without congressional and legislative input, to completely reorganize federal agencies. That was on May 9th, and there was a minute where we thought maybe these individuals would actually be brought back who had been fired. But unfortunately, July 9th, which was just a week ago, the Supreme Court upheld, because this went to the Supreme Court, upheld Trump's ability to fire summarily all these federal healthcare workers. And the Supreme Court is actually the final court of the land. So this is a court that has backed a lot of these decisions, and that just happened last week. So I don't think, at least at the moment, that those federal workers are coming back. So how does this play into the NIH, the CDC, and the FDA, where we all think of those organizations as important organizations organizing human health? Well, if we think about the NIH, the first thing that happened is February 7th, there was an announcement that the Trump administration, was going to take all NIH grants. And the way that NIH grants work is they get distributed. People apply for grants. These are investigators, and they go through a peer review process. And if they actually get deemed meritorious, the institution gets the grant. But the institution, like UCSF, would get a grant, and then they would get an additional payment above that called the indirect rate, which actually supports staff, administration, the ability to administer the grant, also laboratory space, lights on, electricity. It's a really important concept that there's this what are called facilities and administrative or indirect rates. And I will give you an example. At UCSF, the indirect rate is 64%, so that's given above the grant. And the NIH announcement on February 7th was the indirect rate would be cut to 15%. So that would really decimate UCSF, which is actually the second largest employer in the city of San Francisco. Now, there was attorney generals from 22 Democrat states actually filed a lawsuit, and there was a temporary restraining order, and then another temporary restraining order, and then an injunction was put on that 15% rate. But the administration is appealing that injunction, and actually, whatever is going to happen, it's going to be some sort of in between. It's not going to likely. Congress hasn't been fighting a lot for what the executive branch has been doing, and they're not going to fight this. So there's going to be kind of something in between for indirect rates. The second thing that happened at the NIH is suddenly, and this is unprecedented because usually a grant, once you've earned a grant, would only be canceled if there was some demonstrated fraud or something terrible happens, but usually they're not canceled. Suddenly all these grants got terminated, and you would get this announcement, and this grant that you were working on, there were participants being enrolled in your clinical trial, was just summarily rescinded. And the cancellations or termination of grants were really based mostly on two executive orders. And these two executive orders came out on the day of the inauguration. So it was a very busy day. I think you all remember January 20th. But on one of the executive orders that came out said that there's no such thing as gender. There's only two biological sexes. And the exact reading of the executive order, which is accordingly, my administration, the Trump administration, will defend women's rights and protect freedom of conscience by using clear and accurate language and policies that recognize that women are biologically female and men are biologically male. And one problem with that interpretation is that actually there is a concept of gender. In fact, primatologists have studied that there's even gender in primates. For example, there are biological males that take on the female role in primate communities, and it's quite interesting, but there's kind of a spectrum along this. But to summarily say that there's no such thing as gender did end up canceling a lot of grants that looked at more of a spectrum of gender. The second thing they did is said no DEI. But the way they said that is, again, that this ends today. Americans deserve government commitment to serving every person with equal dignity, and so we will no longer support diversity, equity, and inclusion programs. And one issue with that is, again, there were a lot of NIH grants that would say, okay, we're going to look at this result of this medication in African Americans and Latinos and white individuals, and there's just a lot of grants that use that language. That was actually language that was put forward by the Biden administration. So these grants were already out there, and they were all canceled. So, and then the other thing that happened is Elon Musk had a lot of power. as you all know, very early on in the administration. In fact, his Doge is actually still present, though Musk and Trump very publicly had a very, ongoing falling out and have been yelling at each other and Epstein files and all that. But so they're mad at each other. But Musk doesn't like South Africa, and so this very quickly, another executive order on February 7th said out South Africa sucks. And the problem with that is then there was no research that was allowed in South Africa. One thing about South Africa is it does have the highest burden of HIV infection in the world, and the highest burden of tuberculosis. So there were a lot of infectious disease grants that were based in South Africa. So all of these topics seem to be off limits. DEI, gender minority, also some other topics came in. Doge came into the NIH and they were embedded. They used to walk into people's offices. These are 20-year-olds because Elon Musk employed 20-year-olds from Silicon Valley, and they would just cut grants that said vaccine hesitancy, mRNA vaccines, sexual minority, South Africa grants, and then Harvard, Columbia, and Northwestern got all of their grants frozen. The terminations essentially had a lot to do with HIV research, because HIV is a field where we do look at transgender individuals. We do also have a lot of diversity because there's higher rates of HIV infection in this country among racial and ethnic minorities. So essentially about half of the grants that were terminated had something to do with LGBTQ health, relates to HIV research, so HIV felt particularly hit. And UCSF has a huge HIV research portfolio because we were the epicenter, again, of the epidemic in this country, San Francisco, in the late 80s and early 90s. So those grant terminations was interesting what happened, because ACLU and the American Public Health Association filed a lawsuit saying this is as ideologic, these are funded grants, there's a contract with the government, and they filed a lawsuit. And on June 17th, actually, this Judge Young, said that all these terminations were illegal and void. And the way he actually said it in his hearing is he said, is our government's policy now one of homogeneity, inequity, and exclusion? And it was poignant that he said that, and these grants are actually being reinstated. It's complicated, but they're being reinstated as we speak. The other thing that happened at the NIH is that Doge was and continues to be embedded at the NIH. So grant money isn't going out. This is a graph from the New York Times, but it's the amount of NIH money that went out under Biden 2021, Trump 2017, Obama 2013. And this very low number is the amount of money coming out from the NIH to institutions in the Trump administration 2025, because they're not letting grants go out. They're searching them. I heard of a grant that didn't go out because it had the word "they" in it. They were actually referring to samples. They were saying samples were collected and they were put in the freezer. But they was flagged by some 20-year-old at Doge as non-binary and gender, and actually the grant didn't go out. So because of that, this is really severely hurting institutions, because academic institutions like UCSF, we're the #1 public funded university in the country. This is making staff layoffs happen. Administrators are being laid off, faculty are leaving, and especially young investigators are very scared about their futures. So the new NIH director started on April 1st, and one thing that he said is one of his priorities, Jay Bhattacharya, was academic freedom as the last one, because he was someone that was put into place that he said he was oppressed in his academic freedom at Stanford in speaking out during COVID. The problem is that they've just cut and frozen all grants to 3 institutions that have a lot of research, Harvard, Columbia, and Northwestern. And the problem with freezing all those grants is that's actually academic freedom, that people can study what they find meritorious and it goes through a peer review process, and that students have the right to express themselves on campus. So because of that, it just doesn't quite make sense, this phrase academic freedom, when Trump has decided that these universities are off limit, these Ivy League universities. So the other thing that happened at the NIH is on April 1st, some of the mass layoffs that occurred were of what are called institute directors, so directors of institutes at the NIH. And they were particular people that had some degree of connection to Anthony Fauci. For example, Christine Grady was the head of bioethics, and she was Fauci's wife. And the institute that he used to lead, which is called NIAID, or the National Institute of Allergy and Infectious Disease, the institute director of that was fired. So none of these people have come back. What's happening at the FDA, CDC, and CMS is a lot, but I won't go into too much detail. What happened at the CDC was they put out guidance, for example, on how to prevent sexually transmitted diseases, and suddenly a yellow box would come up that the administration made them put on their website that said, we don't believe in these guidance. We don't endorse this guidance. This is, for example, how to prevent STDs. And the problem with that is it looks ridiculous because the CDC is the government agency for public health, and suddenly there's this yellow box that says this page does not reflect biological reality, and therefore the administration and the department rejects it. And it's sort of unheard of. I mean, it's unheard of to have this kind of input into public health. And there were a lot of mass layoffs at the CDC. The CDC was particularly hurt, and there's kind of no rhyme or reason for a lot of the divisions that were hurt. It wasn't just HIV prevention and STD prevention. For an example, everyone was fired at childhood lead poisoning, and no one can understand why we shouldn't be looking at lead poisoning in children. So there was a lot of cuts that actually no one really could understand. And on this was quite a surprise, but on June 9th, the RFK Jr., the Department of Health and Human Defense, HHS Secretary, suddenly fired the entire advisory committee on vaccines, which is called the ACIP. So he just fired them and then put 8 people in place, one of whom is specifically extremely anti-vaccine. And the worry about that is that people will get the impression that vaccines aren't important, which they are, and will take up less vaccines. And actually, as a very specific example of that, I want to just make one foray into measles, which measles is, actually was described first in the 9th century. So we've had measles for a long time. It's caused by a virus called the rubiola virus. And the way that measles works is you get it from respiratory spread, and it really essentially it takes about 10 days in which first the person who has measles has fever and red eyes and runny nose, and it's hard to see, and they're coughing, and then actually the measles virus directly goes into cells that go over to the skin, and your own body's attacking the virus in the skin, and that's what causes this characteristic rash of measles that's shown here. It's a very deep-seated rash. And then after that rash appears, you're no longer infectious. There's also some mouth findings. They're called Koplik spots. It looks like a strawberry. And there's little white spots on the tongue. And then after that, you're no longer infectious. And unfortunately, especially in children, measles can be very, very harmful. It can be deadly. So, and we've had a vaccine since 1965. So people born before 1957 in this country have likely all been exposed to measles. But anyone after that, we essentially give the measles vaccine, and we have eliminated what's called elimination or eliminated measles in this country. For the last 33 years, we had very low cases of measles. Usually they were imported if someone were visiting from somewhere. And now, unfortunately, we're no longer in that position. We have 1,280 measles cases in this country since the beginning of this year. We've had 3 deaths, 2 among children, and we actually have hit our highest level of measles that we've had in 33 years. Just this last week, the Democrats have asked in Congress to declare a state of emergency. They wrote a letter to RFK Jr. saying we need a state of emergency. We need people to be vaccinated. Measles is spreading, and there hasn't been any response, unfortunately, from the HHS secretary. And then one of the final things that the White House is doing is proposed to have deep cuts in some of these federal agencies. So, for example, proposed an NIH cut of 40%, really unheard of because biomedical research funding has traditionally really had bipartisan support. Science and disease, unfortunately, does not, care about blue states or red states. And so cancer research, for example, has been profoundly supported by both Republicans and Democrats. But the 40% cut has been proposed for this NIH, CDC 44% cut, and National Science Foundation 58% cut. Now, luckily, these were not in that big bill, so these have not been cut yet. And I think we have a real chance and hope that the senators, after they passed Trump's big bill, will push back on these cuts. And then finally, Medicaid, and I'll end with that and then get your questions. What happened with Medicaid? So what is Medicaid? Medicaid really supports health insurance for low-income individuals, but also there are 2 times in life where things get really expensive. And one is elder care. So one is nursing home care, assisted living facilities. So Medicaid, even if you are privately insured, will support elder care, will support nursing home and living assisted facility care. The other time that's very expensive is labor and delivery. So even if someone is a pregnant woman who has health insurance, there's actually Medicaid kicks in during the labor and delivery for women in this country. So Trump's bill that he proposed and has now passed by both the House and Senate in this very dramatic way that you all watched on July 3rd was when we hoped the Senate wouldn't pass it, but they did right before the holiday. Proposes a $1 trillion cut to Medicaid. And what that will really nonpartisan groups have estimated that 11.8 million Americans will be cut off of health insurance as a result. Rural hospitals are more likely to be hurt. And also there's been a calculation there'll be 51,000 excess deaths per year in this country because of these deep Medicaid cuts. So this is passed. I mean, this has happened. Now there's still a hope because they were very clever and they timed the Medicaid cuts after the midterms because they thought people wouldn't vote for Republicans if they were feeling the deep impact of Medicaid cuts. So the hope would be that after the midterms, we're getting into election season for the 2028 election, and maybe there'll be some way to rescind this. But at this moment, right now, it's law in this country that Medicaid will be cut by this much. So I do think it's an unprecedented time of effects in public health and global health and medicine and science. It's really unprecedented. I certainly have never experienced this in my career. And I want to end with a patient's email to me where she wrote just simply on April 9th, am I going to die? And that was her simple question to me. And of course, I did reassure her I didn't think Medicaid would be cut. But that answer is very different on July 3rd. So I will end there and get your questions. And sorry to kind of present something that wasn't that positive, but there are some good things, right? Okay, thank you.
Great talk. Thank you very much. I'm going to take the first question just because I had to get all the way up here under duress. And my question is, I read in the Times this weekend about all the young researchers who are working on grants and working through their scholarships and doing science, and they've all lost everything. Their PhD stuff is down the drain, their thesis is gone. What's going to happen to science if we lose the youngest, brightest minds?
Yeah, I think that is one of my biggest concerns is what we call them early stage investigators, but it's the young researchers. And for example, I mentor a lot, and I had a mentee who had his grant terminated, and he started applying and looking around and went to Gilead and put in applications places, and he is a talented researcher. So there was this worry that we're going to lose those early stage investigators. Indirect rate cuts will cut PhD programs and already did. Actually, the impact has been so quick. For example, the UC system put in a hiring freeze just 2 months after the administration started. And that means that already PhD programs have been cut, and and actually MD programs not, but PhD programs, because MD programs are supported by Medicare. And that means that there'll be fewer and fewer, researchers and investigators. And so I keep on thinking about what are generational impacts. There are some impacts that, like, for example, PEPFAR, if it comes back, absolutely people have passed away from what's happened with PEPFAR to date. But if it actually came back, we could revive, we can't bring them back, but we certainly could help other people living with HIV. But I think there's some damage that's occurring that is, that will take generations to come back, and that's one of them.
Great, thank you. So, great question from one of our guests, which is, what do you think is the end game, the end goal of all these cuts in healthcare research and science? What are they trying to accomplish?
Yeah, this one, I have to say, really puzzles me, because I think about just the human condition. And the human condition, by definition, is that, unfortunately, we all we can get ill, and we are all going to pass. As one Republican senator very famously said, "You're all going to die anyway." But this is the human condition, and the entire purpose of advancement in technologic and science and research is to extend life, and is to make life better, and is to have your loved ones with you longer, who are living with cancer or diabetes or any number of conditions that we can all get. So I can't say that I understand the attacks on health and the attacks on science, because those seem to me as bipartisan as it got. And, when you look at Project 2025, which they're following it very well, and very closely, Project 2025 did lay out all these cuts. It just, I don't think anyone really thought they'd come to pass. And the one thing that is happening is the judicial branch is pushing back against the administration, except when it gets to the Supreme Court, and then they uphold things. But the legislative branch has been pretty quiet, and that's a little bit hard to contemplate as well. A lot of constituents are going to their senators and congresspeople and saying, don't cut Medicaid, but they did all pass that law.
Okay, great question. So next one is, Ryan White is expected to see a loss of $1.7 billion. With those funds missing, what will the nonprofits and public health departments do now?
So actually,
explain what Ryan.
Yeah, Ryan White is an amazing thing. So Ryan White, who that person is, actually was a little boy. So he was a little boy that, at the age of 11, in the early. So he was 17 when he died, and he died in 1990. And when he was 11, he was in Indiana, and he couldn't go to school because he was trying to get into school, and all these parents linked armed and blocked his entrance into school. And the reason they were blocking him his entrance into public school in Indiana is he was born with hemophilia. He required transfusions, and we didn't know about HIV. We couldn't get HIV out of the blood supply. We didn't know enough about it, and he acquired HIV from a blood transfusion. He died of AIDS when he was 17 years old. In 1990, April was when he died, and in August of 1990, Congress passed a bipartisan public health program called the Ryan White Care Law. And what Ryan White Care does is that it provides funding for low-income clinics, like the clinic that I direct at San Francisco General called Ward 86, to provide wraparound care. It provides social work services, case management. It allows people with HIV to really live with dignity and in this country, and it's had profound bipartisan support. And actually, I will say that the one thing this administration isn't doing as much of is hurting Ryan White. They have hurt some of it, but not to that degree. There's something called Ryan White Parts A and B, and they haven't touched that. They've touched something called Part F, which will cut care for women and children, which isn't great. And then they've also cut dental services for people living with HIV and housing services. So they haven't killed it as much as they've killed a lot of other programs.
Great. I can tell there's not many doctors in the audience because I can read these, and so thank you. HIV surveillance reports take a long time to generate. Some of our most recent data is really from 2023. When do you think we'll see good data from 2024, starting with the inauguration?
That is a great question, because the question is really implying, are we going to see increased rates of HIV infection in this country as a result of these cuts, which I absolutely think we are. So Trump, in his first administration, actually started an initiative that Robert Redfield, the CDC director, really pushed, called the End the HIV Epidemic Initiative. And EHE, it's referred to, and it has 4 pillars. It was responding to outbreaks. And you know what that was from is that in Vice President Pence's state, Indiana, there was an outbreak because he wouldn't provide clean syringes for people who inject drugs. And so there was an outbreak of HIV. So one of the pillars of End the HIV was responding to outbreaks. The second was diagnosing HIV. The third was treating HIV. And the fourth was preventing HIV. And it's been profoundly successful. And so what was incredibly bewildering is why the White House budget actually proposes to completely cut End the HIV Epidemic Initiative when it was started in the 45th administration under the same president. This is what we're asking, like, what makes sense? And so that doesn't make sense. So yes, I do believe that HIV incidence rates are going to rise in this country as a result of this administration's policies, and it's going to take a really long time for the CDC to report that, because 2,500 people have been cut from the CDC, and they're proposing a 44% cut. So yes, I think that's going to happen. I will tell you that in South Africa, we already know that more babies, this was in The Guardian, and I talked to the researcher who put out this data, more babies are being, very high rate of babies are being born with HIV infection since the PEPFAR cuts in South Africa. So something that we knew how to prevent was babies being born with HIV. So I find that really tragic, is the increasing rates of infant HIV RNA diagnoses.
Okay. So one of our guests asked, do other nations have capacity to fill the void left by us? Will China step in? Is India going to step in? Is Europe going to step in? And can they do it?
It's an excellent question, because the thing is that at the same time as all these cuts are occurring from the U.S., there hasn't been a rush by the UK or the European Union or Australia or Canada to actually fill the gap. The U.S. had a very unique role in this country, in this world, in this planet, and that unique role led from being the richest country in the world, but also the concept that we talked about before that was actually started by FDR and then continued with, really enhanced during the JFK administration, the idea that we have better standing when we're nice to people, when we give foreign assistance, when we help starving children, when we get a place at the table of global diplomacy. So no, other countries unfortunately have not rushed to fill this gap. One thing that's happened in China, however, is that there's a lot of, and Susan Collins said this in a hearing recently about the NIH budget, China is really picking up scientific research funding. And that just makes people upset here, because then if the gaps in medical research is filled by China, and we don't have a good relationship with China, then we may not benefit from those technological advances. So that the China is for sure, but it's not necessarily helping us. India's not rushing. India doesn't actually have the funds to do this. So no, we had a very unique place in the world, and we burned a lot of goodwill over the last 8 months.
We saved more lives and fed more children and prevented more diseases than anybody ever did, starting with the Marshall Plan.
Yes.
And I can tell you, having served in uniform for a long time, that USAID was the best bang for our buck, not only at preventing warfare, but preventing global migration, as well as the spread of disease to the U.S. It was a very, very good investment. So we basically shot ourselves in the foot, but that's a whole nother lecture.
Yeah, USAID is tragic.
Yes, it's terrible. Will the UCSF Medical School be impacted by the cuts?
I mean, we are being impacted. It's very funny. It's not funny at all, actually, but there's something to be said for working there, because we have these Zoom calls where we'll meet in person, and everyone looks so upset. Like, there's one person's like on Zoom going like this, and one person's covering their mouth, and then there's like someone turns off camera because they're crying. Like, no one's happy. But I will say that the things that have been happening as the second biggest employer in San Francisco, to have staff layoffs is very tragic, and that is starting to happen. We've had to lay off staff that are funded by NIH grants. Now, I do think that UCSF is fighting, resisting, actually, like the leadership goes to Capitol Hill. I accompanied them last week to the NIH, like begging and fighting and trying to put forth why medical research is so important. So UCSF is doing a good job resisting, but we will be affected, and we will come out a different institution at the end of this administration.
So kind of tailing on that one, another guest asked, what advice might you have for early career scientists heading for their PhD who are going to be affected by all these cuts?
You know, I don't actually tell them. I tell them to hang in. Like I tell them to, the mentee that I told you about, I said, you know, go to Gilead. You can go and look at Gilead, but you're a talented researcher, and hang in with us. We're going to make it. We're going to do this. We're going to get through this. And that's how I say it, because I do think that there are some things in the world that are very obvious. And one is we want cancer, diabetes, research. We want research, like, 'cause that makes our lives better. And I just think that the arc of justice is long, and I think it's going to get better.
Okay. Great question. What can you envision as a game plan other than just electing Democrats?
I mean, actually, that's the interesting thing, is that this is a unique administration because it's not necessarily a Republican agenda to, you know, cut. You know, a lot of the Republicans who are pushing back are saying, you know, our constituents are coming to us and they are on Medicaid and they didn't want Medicaid cut and they don't want their cancer research to cut and they don't want these cuts. It's never been considered a Democratic or Republican agenda to support health and medicine. So this is a unique administration, and this is a unique person who's our president. And I don't think that it's that. I think, you know, the one question is, can you reason people out of this? And you can, actually. For example, it was the showing of the deaths to Rubio. People showed him how many people are dying over the last 8 months from these PEPFAR cuts, and those stark presentation of deaths. Just today, the White House said, okay, well, we'll allow the PEPFAR program not to go in the rescission budget. I mean, that was hopeful to me that happened today. So I'm going to just say, good and light and truth will win out.
Very good. I want to take a dive back into when I was a kid and schools were being closed because of outbreaks of polio. Something probably nobody in this audience has ever actually had to deal with or think about. But I can remember when they invented the vaccine and we all lined up outside the school nurse's office and got a sugar cube. And that was how we got the schools reopened. And now we're kind of doing this anti-vaccination where we're seeing measles and we're talking about HIV and drug-resistant TB. Are we likely to see an outbreak of polio? Is this going to come back if kids stop getting vaccinated? Yeah,
so polio is very interesting, an important virus, because taking a step back, when we think about the concept of infectious diseases, what are we trying to do with diseases? There are 4 stages. One is control. So the first stage is you're trying to control an infectious disease. The second is elimination. And elimination actually is the concept that you would have few cases across a region. So we had formerly eliminated measles. The third concept is eradication. And eradication is actually 0 cases on the planet. And there's only one virus that's been eradicated in humans worldwide. What is that virus? Smallpox. So we eradicated smallpox. It's like the most profoundly incredible thing. And that was because people lined up and they did get the smallpox vaccine. And importantly, there are no animal reservoirs of smallpox, and that means it couldn't enter into humans from animals. And polio, and then the final stage, by the way, is extinction. And there's a vial of smallpox in Moscow, and there's a vial of smallpox at the CDC. And if we dash those to the, threw them down the sink, we would make smallpox extinct. But it's not extinct; it's eradicated. Now, polio. There was a great hope that we could actually eradicate polio. And that's because it's only in one animal reservoir, and that's primates. And so because it's not in dogs and cats and big cats and, all the, for example, animals that COVID-19 is in, polio could actually be eradicated. So the way to eradicate polio is, like you said, vaccination. And in low-income countries, actually the vaccination is given in the way that you described. It's an oral polio vaccine, because what that does is it actually gets passed in the stool, and you get sort of mass kind of fecal oral immunization around the country. And then what we do here is the inactivated vaccine, so the shot in the arm. And do I think that polio could come back? I do. Mitch McConnell actually had polio as a child, and Mitch McConnell was very, before he retired from the Senate, was extremely upset by the anti-vaccine sentiment during the hearings of the HHS secretary, because he was someone who knows firsthand what it felt like to have polio. I just went to the NIH last week, and outside the building was the sign of FDR putting in, inaugurating that building in 1951. Actually, I'm not sure if I got that date right, but he was inaugurating that building because he himself, as you know, was in a wheelchair because of polio. So the idea of polio coming back is very sickening, and certainly any virus that causes paralysis, we do not want this to come back. And USAID did have a role to play in eradication. Yes, there was some politics of USAID, but we didn't have to throw out the entire program because of the politics.
Great, thank you. So I have the perfect question for an end note, which is, how do you preserve your sanity while you're reviewing all this data and going to Washington and talking to us about all the cuts, all the damage to science and medicine?
I really appreciate that question, because the way I did it was, at the beginning, was Ben & Jerry's ice cream. So my children are in the back of the audience, and they can attest that one night, and this was the night, I think this is the indirect rate night, I ate 2 pints, and that was like just full on. And so first it was,
that's good to know.
So first it was ice cream, and then I actually had to get away from that because the effects are showing. And then I am stressed. I mean, I actually have problems sleeping and do have difficulty, but I am going to turn my mind to, again, these, what I call these fragments of light that are coming through. I consider today what happened with PEPFAR huge that they took it out. If they preserve PEPFAR, I'm telling you, I've done a lot of international HIV. I will be so grateful. PEPFAR is such an incredibly important program. Huge that Judge Young was the judge that said that the grants that were terminated have to come back. We have 3 cats, and I've renamed them. One of them, Judge Young. I keep on, I'm like, oh, Judge Young, come on in here. Time to eat. So I'm going to stay with the fragments of light that are coming through, and I do think that, again, arc of justice is long.
Very good. Thank you all very much for joining us tonight, and thank you, Dr. Gandhi.